This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
So I had a 22-month-old that came in with a seizure. As far as assessing whether or not that's a simple febrile seizure or a more complex seizure, are you guys familiar with the concept of a simple febrile seizure? What would be the characteristics of a simple febrile seizure? So it's
Just
kids.
a quick rise in temperature, or is that what you mean?
Well, yeah, I mean, it actually has sort of a clinical definition, because the distinction for us is if it meets those characteristics, the patients do not require medication, and the evaluation is really just for the fever itself. The patient generally has a rise in temperature, and it's usually the absolute temperature is high or the rise was rapid. And kids, they have immature nervous systems, myelin sheaths aren't fully developed, so that type of insult can trigger a convulsion. In terms of the seizure, the patients generally have a specific age, which is 6 months to 5 years of age. They have a rapid rise in temperature, have no preexisting seizure disorder, and there's no other sort of substrate for the cause, such as a metabolic cause or infectious cause. The seizure has to be nonfocal and lasting less than 15 minutes. Anything that doesn't meet those characteristics would generally require some consideration of further evaluation and treatment. That would be blood work, brain imaging, lumbar puncture, consideration for that. If it's just a simple febrile seizure, it's just fever control and an evaluation for what the fever is, which oftentimes is just a viral syndrome, but there's a sort of specific algorithm based on the age of the kid, 0 to 1 month, 1 month to 3 months, 3 months to 36 months, that we utilize. But hopefully that gives you a little bit of a perspective. If a child comes in the right age group, has a seizure less than 15 minutes with no focality, then it constitutes a simple febrile seizure. If that child is having a seizure, what are sort of the first line meds?
Give a benzo.
Right.
Fever, right?
So it's a benzodiazepine and fever control. In terms of the dosing, it's good to have some of that just close at hand. Usually our first line is Ativan if they have an IV. And if they don't have an IV, it's either establish an IO and provide benzo, or if it takes more than a couple of minutes to establish access, then it's what medicine? Do you guys know?
Rectal per se?
So you can use rectal, usually diazepam, 0.2 milligrams per kilogram, but oftentimes now we're using intranasal, so it's 0.2 milligrams per kilogram of the Verzemniks. Hopefully that'll just give you a perspective on how we organize our decision making in terms of the workup and treatment of a usually simple febrile seizure. Anyone have any questions?
Is there a genetic component at all? Like if you're folks out of the kid might have it or no?
Yeah, it ends up that sort of the way they get at that is the risk of developing epilepsy if you've had a simple febrile seizure is about twice your baseline risk. And epilepsy has a familial component. So if you develop a simple febrile seizure, there is a milieu of genetic factors that predisposes you to developing future epilepsy. The risk of developing a seizure disorder with a simple febrile seizure is something like 0.5 to 1%, and it's in general accepted that it's about double the risk of developing epilepsy as baseline. So that would have the genetic component.
The Emergency Medical Minute would like to thank our sponsor, Swedish Medical Center, for helping fund our nonprofit organization and make this podcast possible. Donations are essential to our organization to cover operational costs and fund the creation of our online courses offering AMA, PRA, Category 1 credits. So if you enjoy our show, and if you're able to make a one-time or recurring donation towards our organization, any amount is helpful. Please click the link in our show notes to make a donation. Thank you for listening.